Well, according to my computer clock, it's exactly 1 o'clock Central European time. So I'm very happy to welcome you all to this webinar. My name is Luc de Witte. I'm currently president of the Global Alliance of Assistive Technology Organizations, in short GAATO. You will see that behind me and also on the opening slide. On behalf of the board of GAATO, and especially the team that worked extremely hard to make this event happen and to do all the preparatory work in global consultation rounds, I really welcome you. It's fantastic to see that so many colleagues are interested in this topic, which I think is a very central topic when you organize the Global Disability Summit. It must be part of it. So we're very happy to be able to have this session with you. During this session, we will talk about grand challenges in assistive technology outcomes. Later on, colleagues of mine will explain more in detail what that means. Before we start, one comment. This meeting will be recorded, so you will be able to see it afterwards. If you have comments during the meeting, please put them in the chat. We will not be able to respond to everything today, but we will definitely analyze it and keep it for future actions. If you have questions that you would like to be addressed by one of the speakers or in general, please put them in the Q&A. You'll find that in the bottom of your screen. Just click on it and you will be able to write your question. At the end of the session, we will take a few, and again, those that we can't deal with will be dealt with separately. What we will do today is, it was just an hour, we will briefly introduce GAATO, and then we'll tell you a bit more about the Grand Challenges project. What have we done? Why have we done it? We go into the definitions of outcomes and impacts relating to assistive technology. We will present something of the process, but the main part of the meeting will be about the results. What have we found? And what are we planning to do with that? And for that, we need your input. But that will again be explained during the session. So please don't leave us. We need you for the final steps after this. In general terms, very briefly, the aim of this whole exercise was to identify a set of global grand challenges relating to assistive technology outcomes. Assistive technology is extremely important. We all know that, but measuring the outcomes of it as well. But there are a lot of problems around it that we want to identify. We did as a global alliance. GAATO is, we try to be a really global organization of non-profit associations whose core interest is in assistive technology. We are all non-profit organizations, mainly organizations of professionals working in this field, of researchers, but also users, policymakers, quite a bit mixed audience. And what connects us is our belief that there should be a world in which all people can access the assistive technology they need. That's what connects us all. And we work towards equitable and reliable access to assistive technology through collaborative research, policy advocacy, education, and awareness raising. And this meeting is part of these activities. The topic we discussed today is a really global issue, and that's why we have taken this up. My colleague Esther Dakin will tell you now a bit more about who is behind GAATO. Esther, please.
Hello and welcome to this webinar. It's very exciting for us all to be part of the Global Disability Summit. GAATO, as a new organization, has grown very extensively in the past 18 months. We have members from all over the world and a network which is spanning an estimated 15,000 professional AT experts. We have the triple ATE from Europe, the European Association of Assistive Technology. And we also have the AATA from Argentina, ARATA from Australia, the ATIA from America, Easton, which is a global organization, and IAAT from India. We also have Resia from Japan, Treats from Taiwan, Resco from Korea, and Resna from North America. In addition, we also have the 2 other global organizations raising the floor, and most recently ISPO, which we're very glad have joined us. This is a very exciting time, and I would like to introduce now Natasha Layton, who will tell you a little bit more about the background of GAATO and AB ideas.
Thank you, Esther. Greetings from Australia. Very excited to be online with you all today. So let's start by thinking about how we define assistive technology. And we have 2 definitions here on the screen. Assistive technology is an umbrella term covering the systems and services related to the delivery of assistive products and services. What are assistive products? Well, assistive products are products that maintain or improve an individual's functioning and independence, thereby promoting their well-being. And we draw that definition from the WHO GAATO initiative. When we think about assistive technology, we then, next slide, thank you, Esther, Emma, we would need to think about what we mean by outcomes and impacts. So there are many aspects of assistive technology that matter, but today we're focusing on, as I said, impacts and outcomes. The impact is the long-term effect of an outcome. Outcomes are finite and measurable changes. They're the shorter-term effects resulting from an intervention such as assistive technology or the introduction of a new program, process, or system. Outcomes are specific effects, and they might be reasonably easy to define or measure than impacts. Impacts are the broader changes occurring within the community, organisations, societies, or environments as a result of outcomes. As we said, they're longer term, they're broader, they might be more difficult to pin down, to predict, or to measure. The 2 other important concepts for us today are outcome assessment, which tells us whether a process has led to a certain goal and is very often used to represent also the quality of that process, and outcome measurement, which refers to the processes or tools we use to measure change. And I'm now going to hand over to my colleague Roger Smith to take us through the focus for today with that background in mind. Roger.
Thank you, Natasha. So what is our focus? Well, identifying the grand challenges or the issues related to the outcomes and impacts of assistive technology at the individual, community, local, national, or global level. Global grand challenges or issues may address tools for data collection, data storage and use, outcomes related to systems and their implementation, best practices, and policies. So why do assistive technology outcomes matter? Well, available evidence in assistive technology is limited, it's fragmented, and it's not comparable on a global level. So we need evidence for justification for funding, policy, and legislation, policy planning and implementation, funding allocation, evidence for assistive technology practice and systems, cost-benefit analysis of assistive technology, the measurement of individual impact, and global comparison. So what are grand challenges? Well, grand challenges, sometimes we call them issues, identify the biggest or most important issues in the field. They're global or regional in scope. They may take years to create solutions for them. They cannot be solved by one person or one agency alone. They require the collaboration of a variety of stakeholders. Solving grand challenges results in impact for a large number of people. So next, I invite Emma Smith to describe our project methods.
Thank you, Roger. So many of you who are here today may have participated in some of this project before, and we're asking those of you who are here today to continue participating in this project. We have used a multi-staged process where we have done regional consultations leading to today, which is essentially the start of our global consultation, which will result in a final list of grand challenges. We held regional consultations across all of the WHO health regions, and those were collaborative meetings where we held discussions and breakout rooms with groups of people to identify the key issues in assistive technology outcomes that they were experiencing. In the first session, or the first half of the session, we did issue identification, which was a creative process, following which the issues were prioritized by the members of those regional consultations so that we could come up with a single list of issues for each region. We then took the lists from all of the regions and we compared them. And at this point, we had about 109 what we felt were unique issues coming out of the regions, but there was significant overlap between them. So at this point, we began grouping similar items where we thought that there was sufficient overlap that the items should be together. So those similar items were grouped, resulting in a list of 39 items. Those of you who have seen the survey already will have seen the 39 items in the survey, and those of you who haven't will see them today. We're now at the point in the process where that list is being reviewed and refined. That we're going to seek your help with, and we'll speak about next steps, and then we will go on to the process of final selection. My apologies. So for a regional consultation update, to give you a sense of where we're at, we held consultations in each of the WHO health regions, resulting in 7 regional consultations between August and December of 2021. Among those regional consultations, we had over 300 participants from 57 countries, and that was made up of assistive technology users, assistive technology professionals, and assistive technology researchers and educators, among others. During that time, as I mentioned, we identified 109 assistive technology outcomes challenges, which we have consolidated into 39 unique challenges. And as well, we held those regional consultations in multiple languages. So you'll see here on the side, we had regional consultations in English, Mandarin, Japanese, Spanish, Portuguese, Greek, Italian, French, and Arabic. So we had significant input in multiple languages as well. We're now going to take the opportunity to share the list with you. We are calling this list of 39 items the long list, as our intention is to reduce this list from 39 to something which is perhaps a bit more succinct, somewhere in the range of 10 items. So we have invited participants and coordinators from our regional consultations to share that list with you in different sections. So I will be inviting our first speaker to begin sharing that list, who is Tone. So Tone, thank you so much, and I will pass it over to you.
Thank you very much, Emma Smith. My name is Tone Øderud, and I'm representing the Association of the Advancement of Assistive Technology in Europe, AAATE, and Norway. AAATE was involved in the coordination of the European Regional Consultation, and I was one of the participants. I will present the challenges identified in the area of potential impact of assistive technology. There is limited awareness of the importance of assistive technology outcomes. Next, we do not understand which objective indicators are required for decision-making and policy development. We do not have adequate strategies to direct data collection for research and decision-making. And in high-income countries where AT is considered a right, we often fail to measure outcome as there is no incentive to do so. I would now like to invite Libby Calloway to present the next slide, please.
Thank you, Tone. My name is Libby Calloway, and I'm representing the Australian Rehabilitation and Assistive Technology Association, or ARATA, in Australia. I was one of the coordinators of the Western Pacific Regional Consultation through my role with ARATA, and I'll be presenting the challenges in the area of outcome strategy. Firstly, we do not have systems that use data and evidence to guide selection of assistive products. We do not have adequate systems for monitoring policy-related outcomes like policy effectiveness or economic evaluation. We often do not have consistent or standardized baseline data to compare with after the implementation of new programs or policies. We do not have adequate infrastructure or systems for outcome data collection. We do not have a way to collect, aggregate, and share data cooperatively on a local, national, regional, or global level. We do not have the adequate systems to measure population unmet need. Data collection is often not incentivised or funded. I would now like to invite Natasha Layton to present the next slide.
Thank you, Libby. And I'm speaking as a member of the African community on assistive technology in lieu of my colleague, Surona Visage, who was part of the African Regional Consultation and one of the organisers. Outcome data collection, we do not have adequate approaches to maximise the use of existing data. It's unclear who is responsible for collecting outcomes data in the service provision process. Even where data does exist, those who collect it often do not have the necessary expertise to analyse or to report it. Data collection is often driven by academic needs, which may not be practical or useful for the people collecting it on the ground. We do not adequately collect and use feedback on products from AT users. And I'm now going to invite my good colleague Takanobu to present the next slide.
Thank you, Natasha. My name is Takanobu Inoue. I'm representing Rationale from Japan. So I was one of the coordinators for the Western Pacific region, Rationale, the consultation, which was hosted by the ARATA, RESCO, TREAT, and RESGER. So I will present the challenges identified in the area outcome measurement. The existing outcome measures do not adequately address all assistive products. We do not have evidence of reliability and validity of the existing outcome measures. We do not have adequate method to measure cost effectiveness of assistive technology, including cost effectiveness across the lifespan and the cost of the failing to provide assistive technologies. Existing outcome measures do not value both quantitative and qualitative data. The existing outcome measures do not differentiate well between outcomes related to assistive technology service provision versus the outcomes related to the product themselves. We do not have adequate tools to measure how usability affects assistive product outcomes. So I would like now to invite Mari to present the next slide.
Thank you, Takanobu. My name is Mari Abu Saad. I'm representing Sesobel, an NGO in Lebanon. I was one of the coordinators for the Middle East Regional Consultation, and I will present the challenges identified in the area outcome skills. Assistive technology personnel do not have adequate education and or training in outcomes measurement. We do not have measures to evaluate the skills of assistive technology personnel, including competency and in outcomes measurement. We do not integrate clinical experience and expertise well into outcome measurements. And I would like now to invite Mrs. Lynn Gitlow to present the next slide. Thank you.
Thank you, Marie. My name is Lynn Gitlow, and I'm from the United States. And I was a participant in the North American Regional Consultation. I will present the challenges identified in the area of outcomes across diverse sectors and stakeholders. Existing outcome measures are not adequate for interdisciplinary use or in non-health sectors. Existing outcome measures do not adequately capture all stakeholder perspectives on the impact of AT on the life of an AT user in a holistic way, including quality of life, well-being, and health. It is difficult to measure the impact of assistive technology across the lifespan. We do not have outcome measures which address needs across settings, i.e. home and work. Existing outcome measures are not standardized or inclusive of different regions, languages, and cultures. It is difficult to measure outcomes consistently across all countries with differing income level, resources, and socioeconomic status. Existing outcome measures are not inclusive of a range of client populations. It is more difficult to evaluate AT outcomes for a person with more complex needs. It is difficult to capture outcomes for people living in rural and remote areas, often due to difficulty completing follow-up. I would now like to invite Maria Toro to present the next slide.
Thank you, Lynn. My name is Maria Toro. I am an assistive technology consultant from Colombia and currently based in Spain. I was one of the participants for the Latin American regional consultation that was held in Spanish. I will present the 4 challenges that were identified in the area of outcomes beyond service provision. First, it is difficult to measure outcomes which are relevant to the perspectives of all stakeholders, including the industry. Terminology across outcomes and outcome measures are not consistent or standardized. We do not have adequate tools to measure supply chain impacts associated with standards and regulation implementation. And last, we are not well equipped to measure the impact of service provision, including products, on the broader ecosystem around the assistive technology user, such as the care providers, the family, and the workplaces. I now hand it over to Emma.
Thank you, Maria, and thank you to all of our presenters and representatives from our different regions for sharing that long list with us. So as you can see, this is quite a challenging list to manage, and it is long. The 39 items are many, and you will have noted that there is still some overlap amongst those items. We have left it with some overlap because we feel that the best people to give us feedback on how to combine some of them or which ones to prioritize are you, the people who are here today, and those who may not have been able to join us but will be contributing to the surveys. So we will be holding 2 surveys, one of which is active, and you will receive the link to following this meeting if you wish to participate. The first survey is going to be gathering information and feedback on this long list. So this list of 39 items. In that survey, we will ask you to review the list, to tell us which items you believe meet the criteria of a global grand challenge, to tell us which items you believe should be combined because they may be too similar or may have too much overlap, and to identify any items which you feel are missing. And I think it's important at this point to say that during the regional consultations, there were many items which were identified by our participants and by our coordinators, which were issues in assistive technology service provision or issues in assistive technology policy or other areas of assistive technology, which were very critical issues, but they weren't specifically related to assistive technology outcomes, which was the focus of our work. We have kept that list, and we want to acknowledge the importance of it. But at this point, the focus very much is on issues related to assistive technology outcomes. Once we receive the results of that survey at the end of February, we will begin to consolidate the long list into something a little bit more manageable, hopefully a little bit more manageable, and hopefully shorter than 39. At which point we will put that together into a survey that we will send out to all of the same people who completed the first one in order to select the top 10. This is not a selection to indicate that these are the only issues which need to be addressed, only that at some point we need to choose which ones to focus on because they are the ones which are the most pressing or the ones which will have the greatest impact. So when you receive that survey, you will be asked to review the items which remain on the list, and then to select those which you feel, based on your experience or on the experiences of the organizations you work for, are those which are most pressing or most in need of being addressed. All of you today that are present here are welcome to complete that survey, and survey 1 will be sent following this meeting. Some of you may have received it already as part of an expression of interest process, and you will not need to repeat your submission, but anybody who has not completed it yet will be welcome to when they receive the link today. So we are now going to go into a period of questions and answers and discussion. I would like to note that we do have a question and answer function available in this webinar format. So please, if you do have a question or something you would like us to read aloud to the group, the best place to put that is into the question and answer box. And I'm seeing one question come up already, which is how long will survey 1 be open? And it will be open until the end of February. So thank you very much for that question. As we give people a chance to put some questions into the box, I would like to invite any of our panelists who are here today, if they have any commentary on the long list or their participation in the process, if they would like to make any comment about that experience.
Emma, it's Libby Calloway from Arata in Australia here. I just thought there was a really important comment from our audience member, Dr. Suraj. So many times, we do not have this means we really need to work hard collectively in a collaborative way among like-minded experts from AT across the world. And what I've really reflected on from attending and participating in the Western Pacific region consultation with our colleagues from many of the Western Pacific assistive technology organisations is how important GAATO has become to this process. So I just firstly want to acknowledge what Dr. Suraj is saying, that I think GAATO is becoming a really central organisation that is able to coordinate these global grand challenge conversations. So thank you for that to everyone involved. It's been a lot of work. I think something that came through the Western Pacific region consultation was the challenge of moving away from those general issues and thinking about AT outcomes. And I wonder if, while we are seeking comments or questions from the audience and others, if we could go back to that slide just to remind ourselves that definition of AT outcomes, so that when our attendees here today are completing the survey, that they can think about, again, the grand challenge of the biggest issues specifically related to AT outcomes. Natasha, I know you read this out previously. I wonder if it's worth us just revisiting this once more as people start to think about prioritising the long list of issues in the area of AT outcomes.
Thanks, Libby. Yes, and you can see with this slide that we did put some references at the bottom because people use terminology quite differently. That's between sectors, it's between regions, countries, between practitioners. I'm an occupational therapist. My physiotherapy colleagues and my rehabilitation engineering colleagues and physician colleagues might use terminology differently. So we thought this was important to draw a line so that we're all talking about the same thing, and we would welcome people's comments on impacts and outcomes of what we should be measuring. And I think as a practitioner, I often feel I have to measure something for the funding body, but I would really like to measure the impact on society in 2 years, 5 years, 10 years on the family and so on. Emma, we have a couple of comments in our question and answer. Now, someone in the chat has asked if we could kindly run through the slides again. So we note that these 39 items across 9 slides can be found in the survey link as well, so they're not disappearing when they go, but maybe that's an acceptable thing for us to walk through as we answer this couple of questions in the chat, in the Q&A.
Absolutely. And just while, as we get started on this, just to answer some questions which came up about the surveys, there was a question whether the survey was covering certain countries, and the survey is global, so there is no limitation on where people are and who can respond to this. The other question was asking about the rationale used for the surveys, and I think there's 2 points here, one being that the surveys are to take the list which we collected from the regional consultations and to distill it into a single list which is global in scope. But in terms of our rationale for using surveys for this process, we initially looked at whether we might be able to have a live consultation process on a global level. We did that at the regional level instead because of the challenges with coordinating people and finding similar time zones. So at this stage, we're moving to a survey at the global level to enable the most amount of people and organizations to contribute in a meaningful way. Natasha, how would you like to go through these slides this time, do you think?
Oh, sorry, Luke, go ahead.
Well, there's one question I would like to respond to in the Q&A, which is about the objectives of GAATO and the relationship with the GATE initiative. And that's, of course, an understandable, a good question. And of course, our aims are quite similar. We all strive to the same aim. But GATE is clearly an initiative within the WHO, led by governments, basically. GAATO tries to connect the professionals in the field and the researchers, the experts, which is a different audience, a different platform to discuss. And of course, we have a very good collaboration with WHO. We are at the point of signing a mutual agreement. So there's absolute good understanding, intensive contact, but our responsibility is different. We want to express the views of the people who work in this field. And of course, with that, we can influence the agenda of WHO and other players in this field. I think that's how we should see our role. That's also why we take up these really global topics, because nobody else does, and we are the ones to we can try to influence it and make a contribution from that perspective.
Thank you, Luke. I'm going to suggest that we move the slides just every 1 minute. You will see a fresh slide with the next set of outcomes as we have this general conversation. I can see Kath Williams, a colleague from all the way from New Zealand, saying really we're hopeful that impacts on society and population, they are important to funders as well. So maybe it's about having a shared understanding of how to measure those, and whether people, practitioners and AT users themselves have the time and capability to implement outcome measures, outcome measurement. What other questions should we answer here? Sarah Gwynn is talking about difficulty measuring outcomes for people living in rural areas. Are there any other communities we think are less heard, and does gender impact on potential challenges? And I wish my colleague Sirona Visage was here to respond to that from her knowledge in the African region. Can I invite any other of our panelists to comment, maybe from the perspective of their regional consultations, what it was like trying to, we spend a lot of time trying to find AT users providers, researchers, educators, manufacturers, suppliers, speaking from the Western Pacific, to invite along. And of course, people needed to be able to access the internet, and people were responding on their phones, you know, in the field. Quite a lot of work went into that. Does anyone have any comments for Sarah Gwynn? I was thinking maybe Maria, you had something to say on this point. Don't want to put you on the spot.
Thank you, Natasha. Yeah, I was involved a little bit in trying to invite participants to join the consultation. And I think that comment also relates to another question in the chat right now that is talking about how people were invited to participate. So from the experience collaborating with Silvana Contempomi from the Argentinian Assistive Technology Association, it was done through different networks, like the association's networks are another informal networks, and also trying to reach out directly to leaders in the community, also to try to involve like different perspectives. And I understand too, it was done through the GAATE listserv, the invitations to participate here. And as far as what I recall from the Latin American consultation in Spanish, there weren't discussions specifically related to gender. That doesn't mean that that is not the case, but it wasn't mentioned in the consultation. So over to you, Natasha.
Come on, co-panelists. I've just taken I'm just putting something in the chat about how everyone can get hold of the recording. And where are we up to with our Q&A? I can see Lucy is asking if we can clarify how we identified participants for the initial regional consultations and what institutions and stakeholders were represented. Certainly Western Pacific was the first one we ran, and we reached out to any assistive technology organisation that we knew of in the Western Pacific based on the WHO regional breakdown, and we invited them to do a snowballing process. Who would be interested to come, who might come. We targeted disabled persons organisations, hospital networks, health networks, policymakers, authors who had been writing in this area, charities who were working in the area, and we invited all of the participants to tell us their roles, and noting people might have multiple roles, might be an assistive technology user and a supplier, for example. So we have all that data, and we really look forward to analysing that.
And just to follow on that, Natasha, in terms of the overall process for the regional consultations, we issued a public call for leadership in each of the WHO health regions. That meant that we had leadership who were located in the region who were willing to move the consultation forward. Each of those regions' leadership, and so Natasha spoke about Western Pacific as an example, the leadership sought out the people in their region that they had through their networks, and used their own expertise within their region in order to identify relevant individuals through whatever networks they had available to them. So it was done in region by the regional consultation teams.
Emma, Barbara's just asked in the Q&A box, what will happen once the top 10 challenges are identified?
Thanks, Barbara. That's a really great question. So the goal of this part of the process is to identify those 10 challenges. We will be producing a report which will outline both the methods as well as the challenges which were identified, which will be published on the GAATO website, and then will be further published in an academic location or publication. At that point, we are hoping to reach out to the broader community, all of you included, to take that list of items forward, whether it's by writing about it, by developing projects around it, but we're hoping to use it to inspire and to propel the questions that might be asked around assistive technology outcomes. And I'm actually going to put Roger on the spot to answer this question as well.
I'll comment briefly on, what do we do with the grand challenges when we're done. And often grand challenges are used by agencies who are interested in solving problems. And those might be scientific research agencies, funding agencies, who can support projects to be able to help answer the questions. And so one of the motivations behind identifying, what are the 10 or so grand challenges is to be able to put some weight behind solving those the problems and answering those challenges.
Luke, do you have a comment?
No, well, just in addition, this is exactly what we want to do, but it's also inspiration. Right? Just an example, in my own university, we are having a strategic discussion about what is our focus for the next 5 to 10 years. And already now, I take these outcomes with me because I bring this to the table. So, well, this is what we need to focus on. And if everyone does that, things might really change. That's at least my belief.
Look, thank you. And I'd like to note the WHO Unicef Global Report on Assistive Technology, which is due out probably in May. GAATO has a piece in there that is talking about this global effort to just share the voices of people from the regions up through the global peak bodies, and trying to hold up a mirror to what it is people think we need. So we're very proud that that will be mentioned in the global report. Of course, we don't have our outcomes yet, but that will direct people to the GAATO website, where we will have this information in the public domain for people to pick up and run with.
Exactly.
Emma, I'm thinking it would be, Evert-Jan has asked about whether there was a significant difference between the outcomes of the regional consultations in terms of focus or topics. And I actually would like to know what you think about that. Emma was, as the person who has organised the method and as the person who has hosted the sessions and made them work, Emma is the only person who has been in every single regional consultation, lucky thing, with many 2 a.m. sessions, I think, from her home. And from conversations, many things were the same, but some things are different, but some were the same. Would you like to speak to that, Emma?
Yeah, I'd love to. Thanks, Natasha. This was a really interesting process. As Natasha mentioned, I was present in all 7 of the regional consultations. Some of them were not held in languages that I could understand, which was actually great. I was there in some cases as a support, but I did get to be a part of the discussions around each of them and in each of the regions. And I think what I was most struck by throughout the process is how much was shared. Obviously, there were differences where resources were different. Certainly, there were things that were experienced in Africa within the African regional consultation, which were different from those things experienced in Europe. There were often shared experiences among places with shared socioeconomic circumstances. But really what was most striking was the fact that people in Europe and people in North America and people in Latin America and in the Middle East and Western Pacific, that everybody felt similarly and had similar challenges that they were facing. They may have been facing them on different levels or for different reasons, but ultimately the challenges were quite similar. In terms of focus or topics, I think there was, the focus was very much on how we can have the data we need in order to make the decisions that need to be made, whether that was at a policy level, at an individual level, in order to develop better programs. There was a general sense that people needed and wanted the data. They just weren't sure how to get it in the ways that were going to make sense for their context and using the tools that made sense for their context. I think the biggest theme or focus across the entire discussion was probably around the need for contextually relevant outcomes at all levels that would help to answer those questions. So I'm not sure if that answers your question, Everjohn. I think really the key was there was more similarity than difference, and that was actually quite good to see.
Thank you, Emma. In response to Teret's very good point, I wonder if we could move to the slide that I really moved very quickly past that has the GAATE 5P ecosystem on when we've whipped through our outcomes there. So Teret is asking how the ecosystem and AT provision can be related or are related. So this slide has the mandala from WHO GAATE, which has had a couple of revisions. People in the middle, provision, products and personnel around the outside, sitting within the context of policy and with global policy underpinning that. And that's, of course, universal health coverage and the Convention on the Rights of Persons with Disabilities. And Tara, in answer to your question as a practitioner, I think they are inextricable. So you can do a beautiful job with the product and the person, but if it can't be well provided, and if our ecosystem to repair, maintain, service, build someone's capability to use it, get it fitted in the family, get it funded by governments and others is not there, then we really haven't got an optimal outcome. Would anyone else like to speak to that just while we read Greg's question as the next one? Oh, I must have done a beautiful job in explaining the 5 Ps, or everyone knows it very well, which we hope they do. Emma, shall we read Greg's point out? Shall I go ahead with that?
Yes, go ahead. Yep.
So Greg, hi, welcome. You'd highlight the item dealing with the separation of the impact of AT itself from the impact of other interventions. We're not likely to get additional separate funding for AT, but if we can show the impact of AT per monetary unit as compared to the impact of other interventions per monetary unit, it might help put assistive technology or appropriately applied assistive technology on a peer with other interventions. And this could lead to better access to the funds used for other interventions. And I must say that really speaks to me. I've for years used Roger Smith's impact model, where you say, what are the things we can do to intervene with someone? It's change body structures and functions, change the environment, introduce personal support, or use assistive technologies, and the money goes to often acute health rehabilitation, and arguably AT is a rehabilitation intervention, and that is certainly more than just outpatients or, you know, at one moment in the health spectrum. But yes, that speaks to me significantly. Any other comments on Greg's point? Luke?
Well, I can only say that I also agree. This is one of the reasons why we do this, to be able to influence this agenda and come up with these kind of data that show what the impact is. I think many experts working in this field know so many examples where it's so obvious that an intervention with AT is so valuable, but we don't have the data, as Roger started in his part of the presentation. We just have very scattered, very fragmented data on what the impact really is. That needs to change. Otherwise, it will never get the attention it needs.
Plus, I think these types of questions that people are bringing up in the chat and the Q&A are really critical, because they help highlight whether the 39 long list items may have missed something, or how we might combine them. So I think these are excellent comments and questions to be able to contribute in this discussion and in the subsequent surveys.
That's right, Roger. And I'd point everyone to the chat box where Emma has pointed some very important figures from AT scale showing a 9-to-1 return on investments for assistive technology. Roger, would you care to speak to Siobhan's comment about multifactorial phenomenon of why people use or don't use their products, and perhaps where that some of our outcome measures are a little bit blunt?
we certainly understand, and so this may be putting on a different hat than one of the team members for this particular consultation, but the multifactorial nature of assistive technology intervention and all the policy and provision and everything that goes around it does get very complicated. And certainly in our research in assistive technology outcomes, one of the things we've done is highlighted that complexity and the not only the stakeholders and perspectives and the breadth of that, but all of the different contributors and covariates in the decision making. So as some of the questions in the chat have highlighted, part of the challenge might be to disaggregate what are all of those factors and how do they contribute in different ways, and that becomes a particularly challenge scientific question as well.
Thank you, Roger. It's 10 to the hour, and I think we've dealt with many of our questions. I'm just going to, Emma, and look, I wonder if we invite our panelists to just give us 2 minutes on how this process has been for them, what their favourite outcome area is that they hope comes into the final grand challenge, or some other comment on what it's been like to sort of gather together in this way across the globe. In our Western Pacific consultation, we had over 100 people who'd never been in the room together before and are still connected in many ways. So that's my moment, and my passion and my wish among all of our grand challenges is that we have a uniform vocabulary. So there you are, I've started that off. May we, Emma, would you guide us around our panelists?
Absolutely.
I can't see anyone saying no.
Maybe I'll start just with who I can see. Takanobu, could you maybe give us a comment on your experience in the process?
Oh, thanks. I would like to comment on the sort of the different perspective of this process of the challenge, the consultation. So, and we had the discussion in Japanese. So the language is always, it's a barrier in the global, the platform, the discussion platform. But we did a lot of discussion in Japanese. So we found many things from within Japan. So, and also the challenges that we discussed is connecting to the global level, the regional level, and also the global level. So that the items are similar to that might be global challenges. So that's the very good findings, and also the very nice process of the consultation, this consultation. So that's my comment. Thank you.
Thank you, Takanobu. Lynn, could I ask you to comment?
Absolutely. As somebody who has been involved in trying to collect outcomes for a while, it's interesting to see how, again, as other people had said, the challenges are similar across the globe, and the critical nature, particularly in the work that I do, is that it's not, it's the only way to get support and move up through the policy layers to get support for the assistive technology that we need, because without these outcomes, we're not going to have evidence to show that assistive technology works any better or worse than anything else that's competing for dollars or money. The other thing that I find as a very huge challenge is to follow up sometimes with the people who we're working with, because they're very mobile, and being able to follow up with them in a consistent way to get the outcome measures is often a challenge, particularly when like we talked about in the beginning of this session, they may be rural. They may not have access to the ways that make it easier for us to get these outcome data. So it's a global and a local challenge. So thank you for that.
Thanks, Lynn.
Asking and doing this work.
Libby, could I ask you to comment?
I'll just briefly, I think referring back to the AT ecosystem of the World Health Organization, a lot of the areas identified relate to people, the person who's using assistive technology. And I think I was interested in listening to Natasha talking about the fact that we don't adequately collect and use feedback on products from the assistive technology user, the person that is central to the AT ecosystem. So I'll be interested to see how this long list becomes a short list. And I'm excited to think that we hold central the needs and views and values of the person using assistive technology.
Great point. Thank you, Libby. Tona, could I ask you to make a brief comment?
Yes, please. And I'm still enthusiastic about being involved in such a huge initiative and including so many people in a very structured way to give feedback. Sometimes we believe we are on our own, but here we have a nice community, which I find very inspiring. And my main input is that I think we often talk about one single items, we tick off on numbers, but to include the more whole ecosystem and include the impact of using AT is important, not just ticking off the numbers that are going into the economical valuations of the funding agencies, but to look into the quality of the service delivery and looking into the whole ecosystem, including the users, of course. Thank you very much.
Thank you. Marie, could I ask you to comment?
Yes, so I want to thank you, first of all, for the organization, because the first time we was asked to make this consultation, it was for me a big challenge, because in our region, most Arab country maybe doesn't know what is assistive technology. So it was a very challenging for us to regroup a big member. I think it was a good number of members who discuss, and actually we had the same difficulties, the same barriers in our region, and everybody was enthusiastic to continue. They want to meet monthly. They want to discuss about this, and even they want to do association to make something to be more active or more a workforce to develop many things. So for me, it was a great achievement, and we look forward to go forward also in our region. Thank you.
Thank you, Marie. And finally, Maria.
Thank you. Just in 10 seconds to second what everyone has said in terms of the community. For us, it was the same, to be able to have a space to share in Spanish. We have a long way to go, and I think we look forward to seeing the result that's available also in Spanish, so we can widely disseminate and continue the long road that we have ahead together. So thank you for the opportunity.
Thank you, Maria. And just in a very brief minute before we wrap up, just as a reminder, you will receive an email if you have registered for this event, which I believe you all have because you're here, that will have a link to the first survey, which will be asking for feedback on the long list. So the instructions will be included in that survey, and we look forward to seeing your responses at that time. I think we will wrap up now, and we'd like to thank you all for your attendance and your participation. It's been a wonderful conversation. So thank you for your questions and your comments in the chat. Natasha, any closing words?
Thank you for letting us present this wonderful information to you, and keep in touch with the GAATO website. Regions that don't have an AT organisation, yeah, I think more regions are on their way to forming that now, having done this holding hands across regions and sectors. So look forward to working with our colleagues into the future. Look, a final word.
Just one final sentence. I think what we have seen today in this session is exactly the reason why we have established GAATO. Just a professional debate, exchange of ideas, exchange of experiences, create this platform to meet and discuss. And it's beautiful that it also leads to some high-level priorities that we can push forward on all the policy agendas. But what you all say is that we have been able to meet to discuss that. That's the main reason why we thought it would be good to have this. So thank you all, especially the organizing team who made this possible. You have done amazing work. It has been a massive project, still not finished, but I'm absolutely confident that it will be a very relevant and good result. Thanks a lot.
Thank you, Emma, for hosting. And now we must all go off to our